Hello, my name is Mervin Ratnasingam and this is my research presentation on the moral dilemma of the surgical separation of conjoined twins in cases where the surgery would endanger the life of one twin. As part of my research, I will attempt to synthesize the views of three contemporary scholars on the subject, while also endeavoring to advocate my personal position and perspective on it. This latter position of mine is what I hope can also be advocated as a plausible Catholic moral position on this challenging subject. To this end, I will provide first some introductory comments to help frame the medical reality of conjoined twins and the moral dilemma associated with their separation. This will then be followed by a summary of the views of Christopher Cowley, a moral philosopher, then Kathleen Kavanagh, a law professor, and finally David Wenkel, a fellow at the Hastings Center for Bioethics. Our starting point then is to frame the issue of conjoined twins and the moral dilemma associated with it. What are conjoined twins? Medically, they are defined as twins whose skin and internal organs are fused together in some manner. The extent of this fusion can vary, which of course further adds complexity to surgical separation, which even under the best of conditions is an already delicate and risky procedure. Statistically, conjoined twins are relatively rare and estimated at approximately 1 every 200,000 live births. But the dilemma before us is not a medical one, but rather a moral one. How do we approach such a complex dilemma? Is not all human life, irrespective of form or appearance, to be treated with equal value and given the opportunity to be preserved? Can the life of one twin be posited at a different level than another? What can we rely on for a morally sound and legitimate approach to decision-making in such instances? It is this latter question that I intend to answer in this presentation. So let's begin first with the view of Christopher Cowley. Cowley, as a moral philosopher, unsurprisingly presents his views through the lens of moral philosophy. As such, he quite refreshingly highlights the constraints of rationality, which is the use of reason for moral evaluations, in highly complex moral dilemmas, such as in the case of surgical separation of conjoined twins. Cowley further contends that moral philosophy, following in the footsteps of science, approaches such dilemmas by establishing what ought to be done, i.e. to surgically separate or not separate in a rather binary manner, and then looks for reason to support that final decision. This, I would argue, reveals shades of proportionalistic thought. Cowley himself critiques this moral philosophical approach by comparing it to seeking expert dental help and relying on the dentist for advice on the best course of treatment. The approach with the dentist is certainly a commendable one when the dentist is a trained professional, competent, and well-versed with the best available course of treatment in the field of dentistry. But as he himself rightly points out, rationality and ethics cannot be treated in a like manner, since they do not possess the same level of quality, authority, or universality as does dental science. In recognizing the limits of rationality, Cowley advocates that such a delicate and complicated moral decision, such as the separation of conjoined twins, cannot be justified on reason alone, and that other factors must be incorporated, including the spiritual and the personal emotional perspective. He further recognizes and advocates for the need of a spiritual supplement, although he admittedly does not elaborate on what this supplement is in his paper. My next reference is Kathleen Kavanagh, a law professor, and in her paper she recognizes and accentuates the dilemma of conjoined twins and their surgical separation, and she interestingly highlights the polarizing effect it has had on Catholic moral theologians. She narrows the dilemma down to, quite simplistically, the justified perspective on what constitutes the ordinary means of preserving life and the extraordinary means of doing so. Ordinary here relates to the offering of reasonable hope of benefit without excessive burden, while extraordinary relates to not offering a reasonable hope of benefit or entails excessive burden. In the context of a position with respect to benefit and burden, surgical separation would result in one twin enjoying the benefit of going on to live a relatively normal life, albeit with additional later surgical repairs, while the burdens are the complicated surgery and recovery, the potential loss of life of one twin, and the emotional drain on the family. Hence, in her mind and in her view, this issue can be boiled down to a weighing of the benefits versus the burdens in the pursuit of preservation of life. In a manner very much aligned with the Catholic Church's position, Dr. Kavanagh also highlights the fundamental premise that every human being possesses, that is, an inherent dignity, and therefore is deserving of respect for their life, since each of us are made in the image and likeness of God. She also posits that the intent or purpose of any surgical separation of conjoined twins is exactly that, the permanent physical separation of the twins. Hence, by definition, she argues that any resulting death, while most unfortunate, is nonetheless a foreseen but unintended side effect. And finally, we have George Wenkel. George Wenkel's approach to this moral dilemma is through the application of the principle of double effect, or PDE. To do so, he outlines the historical basis for PDE, while criticizing previous myopic and biased applications of PDE. He, I think, rightly articulates PDE in this way. When faced with a choice towards a good, which may also inevitably produce an evil, i.e., a double effect, one should analyze the choice carefully to reaffirm that this choice is still the right thing to do in light of the unintentional evil that will result. Consistent with Catholic teaching, Wenkel reiterates the 4 defining criteria or conditions for justifying moral action based on PDE. Very quickly, the first condition, the choice of behavior must be objectively something good. The second condition, that evil is not a means to any good. The third condition, that the intention for the choice is for good and not evil. And fourthly, that there is a proportionate reason to make the choice, i.e. the good obtained is proportionate to the evil that is permitted. In order for PDE to be used to justify a certain decision, all 4 criteria must be equally satisfied. That said, Wenkel is of the opinion that PDE cannot be applied to cases where the surgical separation of conjoined twins could result in the death of one. He argues that PDE cannot be appropriately applied when the death of one twin is the only option available to enable the other to live. He bases his position on the contention that condition 4 cannot be adequately established. That is, the good of preserving the life of one twin through surgical separation is proportionate to the evil of the imminent death of the other. So, what are we to make of these views? I think a helpful starting point is to reiterate, very briefly, the threefold Catholic dimensions to moral evaluations. These dimensions are the object, i.e. the choice of the decision and being able to grasp what an individual is doing by placing ourselves in the perspective of the acting person. Secondly, the intention, predicating the choice, which is the end that is desired and the true reason for a certain action. And finally, the circumstance, which refer to the finer details associated with the action, which cover the where, the how, and the whens. Using this framework to establish the object, intention, and circumstance can, I believe, help provide a preliminary moral context by shifting through and eliminating the non-benign aspects. All three constitutive elements, object, intention, and circumstance, need to be correctly ordered for an act to be considered morally good. For instance, if a doctor intends to pursue the surgery to separate the twins to advance his own medical career, then the object and intention of the action should be called into question. Or if the parents decide to pursue surgical separation because of the fear and anxiety of society's perception and treatment towards conjoined twins, then again, intention can be called into question. We can align ourselves with Cowley's assertion that the moral evaluation for such complicated cases cannot merely rely on human reason. I think it highlights very well the limitations of ethics, which is based on human wisdom, human reflections, human experiences, and further, like all things human, reason is fallible and limited. While Cowley does acknowledge the need for ethics and rationality to be supplemented spiritually, he does not elaborate on what this supplement entails. But I would propose that this supplement is Catholic morality, which is based on reason, enlightened by faith, and divine revelation, which is infallible, universal, and immutable. Cavani's premise on the primacy of the dignity and respect for all human life, irrespective of its deficiencies, abnormalities, and irregularities, is another key principle that we can tap on. The sanctity and sacredness of human life is, I would argue, a moral absolute, and one that cannot be justified morally except under extenuating circumstances, such as when Thomas Aquinas elaborated in his work on killing in self-defense. That said, Cavani, in my opinion, leans towards a proportionalistic approach in advocating for the weighing of the benefits and the burdens associated with surgical separation of conjoined twins. I further contend that Wankel, with his perspective on the principle of double effect, provides the most robust and cohesive framework for moral evaluations. That said, I beg to differ on his position that PDE cannot be applied to the surgical separation of conjoined twins, where there is the threat of death to one. For example, in the case of a parasitic twin, which is a twin that lacks its own life-sustaining capability and is instead totally and utterly reliant on the other for sustaining life, in such a situation, I think it is plausible to argue that surgical separation is justified based on PDE. As such, I advocate that PDE be utilized as an initial framework to help define what is morally permissible in the surgical separation of conjoined twins. Perhaps more importantly, moral evaluations in such complicated cases should never be reduced to the mere mechanistic application of the letter of the law. So we return to the question we would like answered. Can there be a plausible position for cases where the surgical separation of conjoined twins could potentially result in the demise of one twin? I think not. This is in part due to the profoundly unique and challenging circumstances associated with the surgical separation of conjoined twins. Instead, what I would advocate is a structure or framework that enables the dilemma to be evaluated in a consistent and uniform manner. This framework can be grounded in the correct application of the principle of double effect to establish what is morally permissible, while also performing a moral evaluation based on the threefold Catholic dimensional approach of object, intention, and circumstance. Ultimately, all of this should be ordered towards compassionately and lovingly providing aid and advice to decision makers. Used in this manner, I believe the moral dilemma of the surgical separation of conjoined twins can be a powerful witness to the grace and mercy of God working in and through Catholic moral theology. Thank you.